I'm Dr. Hart. I'm here with Mr. Chesney, who's one of my patients at 2.5 months from a partial knee replacement. And we're going to talk a little bit about your experience with ortho Westmount with myself and having a partial knee replacement. How old are you and what kind of activities were you doing before you started having knee problems?
Today I'm 72, going on 73 in a couple of days.
Nice.
I was and I am becoming again very active in sports. I used to ski a lot, do some snowshoeing in the wintertime, play golf, do a lot of cycling in the summertime. So and I'm becoming again very, very active.
And what happened to your knee? What were your symptoms? When you started to develop arthritis, how did it prevent you from doing what you love doing?
It happened about a year prior to my surgery. I started having pretty severe pain in my knee. And then I think I went through all of the hoops that a lot of people go through. I went to see one specialist. They took a fluid out of my knee. I received injections at Saint-Visc. Then I received other injections for de la cortisone. I had a brace that was prepared for me. The brace was a good thing because without the brace, I was up to the point where it was very, very difficult to walk. So with the brace, I could walk, but not very long. Playing golf about the 13th hole, I was wishing that the clubhouse wasn't too far. But I still played, but I was all crooked when I was walking. And one orthopedic surgeon said that my knee was probably in need of a replacement, une prothèse. I think life was not so much fun anymore. And a friend recommended Dr. Hart. I had no idea who Dr. Hart was. Didn't even know his name. Didn't even know he was in Westmount Square. I actually didn't even know there was such a large facility in Westmount Square. Medical facility, I mean. So my friend recommended. My wife is a doctor, is a former practitioner. She came with me. We met with Dr. Hart. As soon as we crossed the door, she said, we're going to have the surgery performed by this gentleman. He's the right person, and they have the right setup.
Okay.
And that was it.
What made you feel like I'm done with non-operative care? I need to do. What was the thing that limited you the most, or what kind of made you cross the line?
It was just the difficulty of walking. I was walking all crooked. I was always limping. I could walk no distance. I couldn't make any distance. I like to do a lot of gardening and things like that. I couldn't kneel. It was no fun.
So maybe just describe, the process of having a partial knee replacement, how your recovery, where you're at in your recovery, and how it's going for you.
We agreed on a date for the surgery. I came in. Dr. Hart told me, listen, you're having an hemiprothèse. I don't know how you say that in English.
Partial knee.
I was having a partial knee replacement, but there's going to be a total knee sitting on the table there because when I start operating, I don't know exactly what's going to happen. So be advised that you may come out with something other than what you bargained for.
Yeah, we always prepare for if we go in the knee and I see that there's damage more than expected or that I see on the x-ray, we always have a backup plan to go to a total knee, but I would say that's very rare.
The operation was performed. I was sedated. I know absolutely nothing what they've been doing in there. I came out. I was in a very comfortable space. Immediately or very shortly thereafter, I was asked to walk. We started walking. A physiotherapist came and she gave me a little program to perform, which was mostly stretching before I could do anything else. My knee was very swollen. I had no pain. I had all of this medication that was prescribed to me, including the naloxone, which freaked me out a little bit. Naloxone is the medication they give when you have an overdose. So I was a little bit concerned with the type of medication that was provided to me, but I had a big bottle of Tylenol. That's all I used. I asked Dr. Hart if I could leave earlier than planned because there was a snowstorm coming in. Dr. Hart had planned that I would be staying 2 nights. I stayed only 1 night because of this snowstorm. When he did his rounds, he told me, well, you're doing fine. You can go. So I said, what am I going to do? There's no pain. He told me, you're not going to like me tonight because tonight or tomorrow, the anesthetic in your knee is going to wear off and then you're not going to like me. You're going to feel pain. I left for home, never felt any pain.
I would say you were pretty lucky because usually when things unfreeze, it can get a bit uncomfortable. So you never needed to use any of the narcotics or any of the level 2 and 3 pain. How's your recovery been since then? We're now at 2.5
Yeah, 2.5 months.
Months?
First month, physio is light because the knee is swollen and I still had the staples in my knee. So you can't bend your knee as easily because there's some limitation because of the staples. Staples came out, immediately there was a large improvement. Could move much easier. I had the physio plan. I followed the plan. I was asked not to overdo it because overdoing the physio may end up being worse than not doing the physio at all. I followed the plan.
You're a good patient.
I have a spouse that keeps me
On
on
track.
the right track.
So how do you find your knee right now? Are you happy with your knee? Do you feel like you've gotten your motion back? You ready to get back to some sports?
Post-op meeting with Dr. Hart was 10 days ago. That was at about 2 months after the surgery, just about. I was ready to go. I thought that he'd let me do all of the activities I'd like to do, but he advised me that I still needed to force my legs and my quads mostly, make sure that all of the tissue was well in place. Now it's another 2 weeks. I've started doing a lot more pressure, weight on my legs. No impact yet, Dr. Hart. I know that you're following very closely. No impact, but mostly trying to build up my strength in my legs. I feel very good, very good.
Yeah, skiing is just a few weeks away. We just want to wait a full 3 months because we don't want to mess anything up in there. Mr. Chesney, thank you for coming in and talking about your experience, and I'm thrilled that you're doing well. You'll be on the slopes, so thank you very much.
Well, the pleasure's mine. The recovery is going very well. I thank you for your support. You were always available, which is fine to know.